நான் இந்த இன்ஸ்டாகிராமுக்கு வந்து சும்மா பார்த்துட்டு இருக்கேன். மற்றபடி இவங்கள மாதிரி போஸ்ட் பண்ணுறது இதெல்லாம் எனக்கு
Hello everyone, I'm audible.
Yes.
Prashant?
Yeah, join finally.
Yeah. I don't know, your photo replaced by mine one.
Yeah, there is a story I'll tell you.
Okay, no problem. So any problem, just ask Shika. I've shared her number in the WhatsApp group.
Yes.
No, sir, nice. It's my screen, sir. I will give you. Yeah. Yeah, I'll stop sharing it. Samir, Dr. Samir, you start because already people have been introduced to the community in the AA orientation. Please start because I have to take class for the another batch. Yeah. It's almost like Zoom only, sir. Almost like Zoom. I'm just sharing my screen just as a trial. Okay. I'll come up once. I don't know where that device model. So now I'll start starting. So very good evening, and it's 5-6 to we will start the our presentation. Before we start, I have a very simple that what can be.
Deepak, good evening. Hello.
Good evening. Just I'm
meeting
helping
started?
the people to join. No, not yet started.
Okay.
We'll wait for 5 minutes.
Okay. Right.
Good evening, Dr. Deepak. Good evening, everybody.
Good evening, Dr. Sunita. Simultaneously, we are doing 2 batches, no?
Yes.
So handling from 2 devices. Even that batch also, I think more than 20 people have joined. 5-6 people having trouble, so I'm helping them.
So you are doing the same lesson in both batches?
No. It's a different. See, your batch
Different.
is already 2 classes are over, no?
Yeah.
Already you
That
have
must
prepared
be.
for AI. Now we are going to start the AI today. What is AI and all?
Oh, it must be really very tedious. Two batches together
Yeah.
simultaneously. Together is different, but at the same time.
No, the thing is, problem, no, you go to this graphy, no, we have
Hmm.
tend to have habit to click on the Gmail immediately because most of us all have Gmail account.
Yes.
That we should not. We have to go to that below that button. You have to
Yes,
enter
your
our email
email.
and then enter the password.
Yes, yes.
Because
That is
Gmail
what we
password,
did. Huh.
so
That
that
is
is
what
why
we did
people
on
are.
the. Hmm. Actually, there is a saying that
Yeah.
the computer is a very polite device. It always asks you and then does what exactly you say.
Yes.
So if you, that is right. But I really marvel at the fact that you're taking two separate lectures at the same time. I mean, two separate batches at the same time.
Because lot of demand was there, no, madam.
No, I'm
So
sure.
it was
I'm sure.
inevitable. In that batch, I think more than now 70 people are there.
Really.
I know most of them. I can't tell no word to them. Prashant, are you there?
Yes, definitely I'm here.
I think now more than 17 are there. Even I'm sending them the Zoom link to them. If they are feeling difficult, they can join through the Zoom also. Most of the doctors are busy with the work. They don't see the WhatsApp. So many times I have put how to log in. Please check 2-3 times. Still, there is some glitches. Prashant will start.
Yes.
So, good evening, all. So, this is our module 2. We are in the module 2. In module 1, if you can recapitulate, we have started with AI preparedness. How ready we have to face the AI in our regular clinical aspect as well as the personal branding and all. We showed some demonstration of some two softwares. So along with that, second class, how AI powered digital apps in mobile and mobile and any tablets, how you can
go through clinical documentation and how to use this digital labs along with some digital therapeutics. So now we are into the world of artificial intelligence. I'm going to share this slide. Is my slide visible?
Yes, yes.
How to? This is not going, Prashant, down.
It's full screen as such.
I've done full screen. Now this is coming now. Yeah, I will click on this. Yeah. Now you can see now full screen.
Yes, yes, it's full screen.
So today's topic is AI foundation and machine learning, deep learning, and choosing the right LLM. So the complete jargon-free guide for the clinician under this small heel nexus, the basic essential course for your first batch. Is my slide moving? So what is artificial intelligence? So artificial intelligence is nothing but the machines are doing our human-like thinking work. The machines are thinking like human. It analyzes how we analyzes, and then it is going to give the desired output. That means machines are becoming intelligence. How we are making the machine to learn is nothing but artificial intelligence. So it will do like human-like activity. Intelligence means reasoning, thinking, analyzing, and giving a proper output. So that is what you mean by artificial intelligence. How we are going to make the machine to learn is what we are going to learn today. So in artificial intelligence, it's like a big umbrella. You can see the left side, it's a big umbrella. In that big umbrella, you have a machine learning, you have a deep learning, you have generative AI, all those things which comes under this big umbrella. So you can ask me, earlier also computers were there. They were doing lot of jobs of human being. What is the difference between the normal computers which we are using since 30, 40 years, and now what is the difference between the computers what we have with AI enabled? See, you should understand what is the normal computer will do, what is the AI enabled computer will do. Two things you have to understand. See, AI enabled computers will do more than what is required. Whereas the normal traditional computer, what it will do, simply like your software, ES star, if you tell them, it will give the whatever it has been thought, it will do the same thing. Like for an example, it will do, just a minute. Yenama? So what the traditional softwares do in banks, in finances, even in your bus conductor, what he will do, he will have a computer which will do the certain job, the traditional job which has been trained explicitly, it will do the same thing. In artificial intelligence computer, without trained software explicitly, it will do the activity. See, that is the difference between the artificial enabled computer versus the traditional computer. To give one more example, if you go to a coffee shop and you go to the coffee vending machine, earlier what you used to ask? You used to ask for a cappuccino, you ask for a cold coffee, you used to give that. Nowadays, AI-enabled coffee vending machine have come. It will tell you last time you tasted only cappuccino. Now why can't you taste cappuccino with some other taste? Why can't you try this cold coffee along with that taste? Something like recommending system, it is going to recommend you. See, that is what the difference between the normal traditional computer and a AI-enabled computer. So it is got some thinking like brain activity, what I mean to say, from the normal routine activity. So in that AI umbrella, you have a machine learning, you have a deep learning. So these are the two important things you have to know. So coming to the machine learning. So in machine learning, the computer will learn from the patterns of the data. Whatever the data you are given, it will learn from the data. There is no hard-coded rules are there. No explicitly trained program is not there. It will learn from the data. So there are three distinct learning strategies in machine learning. You must have seen there is a course of BA with artificial intelligence with machine learning. So we have three types of machine learning: supervised learning, unsupervised learning, and reinforcement learning. So you have to remember machine learning is a part of artificial intelligence which learns from the data. There is no hard-coded rules. In that we have three types that you have to remember. So one is a supervised learning, another is a unsupervised learning, and another is a reinforcement. So supervised learning means, to give example, you have a intern or a junior doctor with you. You train him like see, this is a case of pneumonia, this is a case of not pneumonia. You call that pneumonia case as a labeled case. You called it as a non-pneumonia as a not labeled case. That means you are telling him these are all the cases of pneumonia, these are all the not cases of pneumonia, depending on the features of your clinical finding and X-ray finding and lab findings. You are telling them this is a positive case, this is a negative case. That is a supervised learning. In unsupervised learning, he is like a good experienced intern or a doctor or a professor. You need not have to tell them this is a pneumonia or not pneumonia. By looking at that person only, patient only, he will tell, he will recognize the pattern, he will tell it is a pneumonia or not. So you got the difference between the supervised learning and unsupervised learning. In supervised learning, you train as per ABCD the person under you. In unsupervised learning, there is nothing like training or something. It will just look at the pattern. Say, for example, you is a more than 20 years senior pediatrician. By looking at the same patients you come across from the different area, you will come to know these are the case of simple respiratory infection. These are the patient with some other diseases. So that is how, looking at the pattern, the unsupervised learning comes. Then comes the reinforcement learning. In reinforcement learning, what you are going to do? So by looking at the recommendation or positive or negative feedback from the patients or your colleagues, you are going to learn by doing some mistakes, trial and error. The reinforcement learning comes. So you should remember, don't go into detail, don't scratch your head too much. Just learn what is supervised learning, what is unsupervised learning, what is reinforcement. This is the machine learning. Why I am telling slow by slow is this is the basic foundation of artificial intelligence. Most of our medical models are developed with supervised learning, very less with unsupervised learning, still less with reinforcement learning. Why I am telling we can't take any risk, so we need what is clarity of the case, and we want to learn supervised learning. For example, if you are taking thousands of X-rays, you see with the professor, you see with the clear-cut image and tell this is a pneumonia, this is a cancer, this is some other diseases by X-ray, then you give positive and then you are going to train the machine. Okay. So there are 3 types of machine learning methods. So I am going to tell you how this is going to analyze the type of study what we are going to do. So this is what labeling the data, supervised learning. You are finding the groups into labels. That means in the clustering, you call it as clustering. Here the feedback comes. So key distinction is you have a labeled answer in the supervised learning. You have hidden pattern has been discovered in unsupervised learning. In reinforcement learning learns to the consequences. So this is the gist of this slide. So what are all the machine learning methods you are going to incorporate? To tell you example, these are the slides we are going to share you. So in malignant and benign conditions, it is a supervised learning. It's called a classification. So you are telling positive, negative cases. This is called classification. There is some data science word that you need not have to think a lot. These are all just you remember: logistic regression, decision trees, random forest. What is SVM? This is support vector machine. Don't bother about these terms, because why I am telling this is, see, whatever these machines, whatever we speak and all, ultimately it will be converted into linear algebra, calculus with these various types of formulas, and computers will understand in the form of 0, 1, 0, 1, 0, 1. What you call it as a binary data or a qubit. You are call it as a bit or a qubit or 0, 1, 0, 1. That is how machine is going to understand. These computers do not have any brain at all. So it has been trained with these types of formulas from the engineers. By giving a good data, then it will be learned. So these are all the various examples in medical community, how this has been converted by machine by using this formula. Just you remember these things. If you want to still go into deep, then you can search all those things. This comes under a very advanced course of learning all these things. Then comes the deep learning. So compared to, you know about what is artificial intelligence, what is machine learning, and what is now deep learning. Again, it's a subset of that umbrella artificial intelligence. In that the machine learning, it is again subset of machine learning, where the deep learning comes. So deep learning is nothing but you are going to learn from the data which is unstructured data with the power of artificial intelligence. How and all I am going to show you. So these are all the examples of deep learning. So there is a data hungriness in deep learning. It craves for the data. It is something like, you can see in the left side, our brain, gray matter. You have a input layer, you have a neurons. There are hidden layers inside, there are weights, and there is an output. You have to remember our neurons in your study days. So you have an input as a data in the form of sensories like eyes, ears, skin touch. So you are going to listen it. It will understand by brain with various neurons. Then the output will come. See, this is what the neural network, artificial neural network. You have an input layer as a data. You have a hidden layers. You have an output layer. So what happens in input layer? It will analyze the data. Then it will go into the hidden layers. In hidden layers, you have a perceptron. Just like neurons in our brain, we have a perceptron. All these things will be there in your computer, where in your CPU or GPU, graphic card, or your semiconductor. So here the calculation takes place. That you have to remember. So you have an input layer, you have a hidden layer, and you have a output layer. In output layer, what happens? The final outcome is going to come. So just remember, in this deep learning, you have a neural network processes in a successive layer, where it will analyze the complex data and make it calculation, and it will give the output layer. So during this, all this adjustment will take place. How it is going to take place? Say for example, I have a neural network here. I have listened to some question. I have answered here in the inner layer. There is some difference of the desired answer and my answer. All these things will be get adjusted because of the weights and biases. Then it will undergo learning processes. It's called gradient descent or forward propagation and backward propagation will be takes place. So the data is going to move around, then till the desired output will get, then the output will come. So this is a long-standing process. It will take place depending on the adjustment of weights and biases. So it is going to give the output. In other words, to understand easily what I can tell, you have around 100 students in your hospital, in your medical college. So one will answer very fast, one will answer very slowly, one will be in medium. So you take out that very poorly performed students and you train them by giving some homework in a different way, not in the same way. So that is what the difference of learning. It's called loss function in deep learning, loss function. Say for example, out of 100 marks, he has received 60 marks. There is a minus 40 loss is there. This is called loss functions in deep learning. So that adjustment, that 40 will be adjusted by this weight and biases. Okay. Not that biases what we tell. It's a biases means it's a cofactor that we add and we make them 100. See, that is how the learning is going to take place in deep learning. So there are classical examples of deep learning is CNN and RNN. You remember CNN means convolutional neural network. Commonly image modalities it has been used. Convolutional neural network, that is radiology, dermatology, pathology and ophthalmology. You remember this. If you have got a NICU, if you have got a cardiac ICU, if I got a PICU, you deal with this RNN, that is recurrent neural network. That means every seconds the data is going to change. For that, this CNN is not going to work. So you need to have a very good memory network called recurrent neural network. So what I'm talking is scribing. At a time, the way of what I'm talking, what the context I'm talking will be recorded. So the technology, what is going behind this Zoom meeting is RNN, that is recurrent neural network. So remember, CNN for images, RNN for the ICU data and natural language processing. So in deep learning times, you have a transformer and GAN. So these are the part of the deep learning mechanism. See, transformers are the one which are there in your ChatGPT, your Claude, your Gemini. So it has a transformer. The GPT means, what is it? You have Claude, ChatGPT. It's a pre-trained transformer model. So that is what you mean by transformers. So what it is going to do, it has got a attention mechanism. Whatever I am going to tell, it will get it into tokenized and embedded, and it has given each and every word will be giving a meaning. That is means self-attention mechanism, so that the context will be understand. Then it will give the output. That is how this ChatGPT, Gemini, Claude is going to answer by this transformers using this attention mechanism. All of you, what you should remember being an AI-enabled pediatrician is, once you give a prompt to the ChatGPT, your prompt is cut into small pieces. It's called tokenization. Okay, from the tokenization, it is get embedded into the transformer. There the attention mechanism will come, and then the output will come. You just remember these two important things. Okay, that is the mechanism of transformer. It is going to give output. So what I told, all this deep learning mechanism, it will be there in transformers of ChatGPT, Claude. So in the GPU, it will take place. For small text and small talking like this, the CPU will work. Whereas in images and videos, you need a very good GPUs, just like NVIDIA and all, where a lot of video and image processing goes. There you need a big transformer in your this thing. Coming to this GAN, this is generative adversarial network. Here what happens, you have a jugalbandi, you have a fight between two. So what happens, one is generating, another is discriminating. That means if I am telling something, there will be somebody we are debating about my word. That is how the machine is going to learn. All your visual images, what you have done in past few days, is mainly because of this GAN mechanism. What happens when you tell the machine to produce some word, it will produce some noise-like images. Then it will characterize what you have according to your prompt. So that means you have a debate between a generator and discriminator in GAN. Why it is important? It is mainly used in the RNN, that is in your time series data in ICO, and as well as in image process. And especially those who are in academics and research, this adversarial network will come. So these are all common deep learning architecture you have to remember. As I told, CNN means convolutional neural network. RNN means recurrent neural network. In that you have long-term, short-term memory. That is called LSTM will be there. You learned about what is transformer, which are there in ChatGPT, Claude and all. So by self-attention mechanism, you are going to understand the context. Then comes the GAN, where you generate the synthetic data. How it is going to generate the synthetic data by discrimination and generating the discrimination. Both this generation and discrimination it will do. So this matches the architecture of data type of all this deep learning. These are all the clinical application you have to remember. CNN for images, RNN for ECG interpretation in real time, saturation monitoring, ventilatory settings. All your smart watches will have this RNN technology. Your Gabit fingering will have this. All your Internet of Things will have this RNN technology. That you have to remember, those who are in neonatology. Transformers, all of you know, all these things will be in large language modules. GAN is mainly for image augmentation, synthetic data sets in case of very rare diseases. Then comes the privacy preservation. Then comes the natural processing. Again, it's a part of deep learning where whatever you produce the voice, it will be recorded and scribed. Or whenever you give a textual format, it will be converted into a language format. In real time, from one language to another language, you can train this. This is nothing but natural language processing. Here the RNN comes. That is how in the AI preparedness I showed you, the voice, enabling the voice, enabling through mic on. My voice is get transferred into a prompt text, and you can do it whatever the things you want by creating the SOAP notes, all those discharge summaries, what Prashant is going to tell. All these things will be done through this natural language processing. So nowadays, the heart of artificial intelligence is generative AI. So what happens in generative AI? The main definition of generative AI is you are giving a data to the ChatGPT or Claude in one form, either in the voice form or in the form of video or in the form of type textual data, then asking them, you create a thing for me. For example, a PowerPoint presentation or a video or an image in a form what you want. See, one form to the another form. That is the power of generative artificial intelligence. So what are all the classical example of generative artificial intelligence? The Google Gemini Studio Notebook LM, where you are converting your PDF into PPT, PDF into an audio podcast or a video podcast or an infographic or a quiz. This is the power of generative AI. So by training the vast data, you can do this. So it learns from the statistics pattern. All this machine learning, deep learning will be there in generative AI. So types of generative AI is text generation, audio voice generation. You can do coding with low code or no code tools, image generation, video generation, and multimodal. So multimodal means just like your Gemini Studio, you can handle both text, image, audio, even ChatGPT, Claude. Most of the Now available large language models are multi-model. So the key term every clinician should know is the large language model. What is large language models? It was built with large amount of language. The Chat GPT, Claude, Gemini. If you just put one by one books over it, the amount of things, it will go to the space. Such a amount of billion parameters of large language model has been developed. And I told you token, whatever the data you give it as an input, as a prompt, it will be break into small words so that the machine can understand. Then it will go to the transformer through embeddings. Then through the transformer, it will make it into output. Coming to the prompt, Dr. Prashant is going to take about the prompting and prompt engineering. It is nothing but how you are going to communicate with the AI. That is very, very important. What is the context window? That means whatever you are typing in the window of the chat box of GPT or Claude Chat GPT, is going to remember. How it is going to remember and convert it. What is the strength of that? How much it will take? You cannot put whole paragraph into that. So it will take only little. So depending on that, the context window will develop. Coming to the hallucination, all these things you are going to learn. It is something like a drunken crazy, your friend. You know, once they have drunk a lot till their throat, they are going to tell whatever you are going to tell, they are going to answer whatever the way. They will be like in a king mode or a god mode and they are going to dominate. That is why this hallucination comes in AI. It is not going to tell, I am not going to answer anything. Something it is going to give you. Whatever the may, it will please you with the good words, but don't believe it as a doctor. Go through it properly. If you have a doubt, check with another model, check with your friends, and any factious report is there. Don't give it and don't use it. That is very, very important. That is what you mean by hallucination. Multimodal, I think already I have told you. So these are all the common LLM players. That is, all of you know, Open AI's ChatGPT is there. You have Anthropic Cloud, very commonly used now. You have Google Gemini. From Facebook Meta, you have Olama or Llama, which is easily available. Okay, these are all 4 common things. Apart from this, you have Perplexity, you have Kimi, you have DeepSeek. So there is no single best model is available. ChatGPT is very good in, it's a best all-rounder. It has a good writing skills. It will analyze the data. It is good in coding, especially codex. For general work, ChatGPT is it's a good all-rounder in a 2020 match. If you come to the Claude, it excels in very good documentation, very sound in very reasoning, especially the Opus 4.8. Today it has been released. And all these slides I have done through this Opus AI along with the Gamma. I am not used single LLM, I am used multiple LLM. So this is the slide I have made through this Claude Opus of 4.8 along with Gamma. So it excels in reasoning, Claude. That is why I'm very much fond of this Anthropic Claude. I have a premium version. Then comes the Gemini. It has got very good, beautiful in doing imaging and videos. It is very beautiful in integrating the languages in real time because Google has more amount of data. And the contact window is very highest, 1 million tokens it is going to take. Of course, this Meta Olama you see in WhatsApp, it is not much good. For emergency, you can use it in your mobile phone. So the ultimate dictum is there is no single best model is available. Coming to this aggregators. Aggregators means in one platform, you will have 2-3 LLMs. That means at a time, you can check 2 LLMs. I'm going to show you in demo now. The one common is that is LM Arena that I'm going to show you. So you can have a direct access with this and you can compare side by side 2 outputs. So this is a free platform. I will show you. You can use it whenever you are free. So how to decide and all? By seeing the output and giving the feedback, you can decide. The common one is Perplexity is there, POE is there, POE. Then LM Arena is there here, or you can see here, arena.ai. So what is the difference between the free and the paid? Always remember in artificial intelligence, don't go with immediately paid version. You ask people who are working really hard for this AI, you know how much amount I pay for every month for this AI tools? More than 1 lakh. in my card every month I spend, because I wanted to explore most of the tools, and by accessing which tool is best, then only I can tell you this is a good for this thing and this is the good for research. All those things, then only I can tell you. Without having experience by copy and paste from Google, I can't tell you now. So that means I have to spend from my pocket to know that, feel that AI tool whether it is performing well or not. So without which I can't tell you and I can't guide you. So first I should try with all the paid models. Then I should tell you this is going to go and invest. Dr. Sham was asking many times, shall I take? Take one the basic version. Then once you are accustomed, then only you pay the paid version, the subscription. And most of the AI platforms now, they are giving monthly subscriptions, not yearly. So take monthly, then you can take yearly subscription. So these are all the slides we are going to show you. You can go through whenever you are free. For the want of time, how to choose the paid one and free one in this slide. So these are the 5 important framework steps you have. Always privacy of patient data is very, very important. Don't put the PHI. What is PHI? Protected health information. Name, mobile numbers, address, age you can put, sex also you can put, but never reveal this personal identity, especially images. You blur the eyes or whichever the part, then you put it. That you can do it, especially if you are a genetician, all those things. So check for the information need. You have to check the LLM, whether it's ChatGPT, whether it has updated or not. Then you have to assess the frequency, how we are going to use it daily or oftenly. Then define the task, writing, research, images, and so all these things. I think Prashant, while telling prompt, is going to tell you. So the clinical decision guide by use cases is for drafting the notes and data, ChatGPT and Claude is best. For quick literature and all, Perplexity is the best. There are other tools that we are going to tell in our next 4 hours class of literature search, that is module 5. In patient education vigilance, DALI-E from ChatGPT, it is there. Midjourney is there. Long document analysis, Claude Pro is good. All this Smart Hill, Nexus, everything I do through this project through Claude. All these things. Comparing the multiple models, you take this aggregate LM, POI, Open Router is there, Arena AI is there. Just a minute. Hello, Prashant.
Yeah,
आप
Deepak.
फिर शुरू करेंगे.
ठीक है, आप stop करो. Yeah, so am I audible, everybody? Yeah, please write in the chat box yes, so that I can come to know that you people are there
Yes,
with
sir.
me. Yeah.
Yes, sir.
Good. So, yeah, good. So yesterday you might, I mean, in the last session, you might have know something about the prompt engineering. And when I was going through the prompt engineering, I thought it is actually very easy. You can make it by your own ways. So what I've done is I just made it in a simple way. Okay, Deepak has not allowed me to screen share. Okay, so by the time he comes back and allows me for a screen share, I'll just tell you, there are few things which are there, which should be there in your prompt. Now, this prompt can be a customized prompt also. Now, for this prompt, I am typing in a chat box the first and foremost important things. Yeah, multiple presenter can share. I think he has given me the access now. Yeah, okay. Okay. So I hope the screen is visible perfectly. The aim of this course is simple, that we are going to have a level 1 AI aware who actually knows the basics of this prompts and everything. Then they are being assisted by this AI assisted tools, which helps in their clinical task and decision making. And now they become the level 3 AI augmented ones. Because of this, their diagnostic and patient outcome skills will be better. And the level 4 will integrate this practice into their day to day practice and they will work efficiently. And once they do this, they will be AI leaders, leading all AI innovations. And for that, Samir Bhai must have told you scope prompting. Somebody will tell you the RCTF prompting. Somebody else will tell you the other prompts. But in general, whenever we are giving a prompt, I'll just take 2 minutes. The way in which I actually give prompt. See, this image has been generated by AI by my engineering, in which I just given an image, and today you people have tried this prompt, a caricature, in which you are adding your photograph and it is turning into this. And this is a simple prompt engineering which has been there, which everybody can copy it. Same way, if I want to make the video of my simple image, I can just give the prompt to a Google Flow. And this type of animation is possible without the help of any designers. So, whenever we are doing this, Deepak has already covered this, so I'm not taking. I'm just saying that we must know the purpose, what we want AI to do. So AI is very friendly. Whenever we say, please do this, then they will do it better. The example of purpose prompt can be write a summary, summarize the topic, explain this in detail, compare this, create this, analyze this. So this is your purpose. After this purpose, the R comes is a role. We assign a role of pediatrician, teacher, counselor, anything to them, and they work better. But most important is our audience. If I'm explaining to parents, my tone will be different. If I'm explaining to MBBS or MD students, the audience makes a difference. And we must give the specific details. As we all are a pediatricians, we must give all these things, the age, symptoms, diagnosis, setting, duration, severity, that will help. And the output should be in a typical format. It can be in a bullet form, it can be in a SOP form, it can be a PPT slide, it can be an infographic, it can be an Instagram post, it can be a tabular form. Or with this, most important is how accurate it should be. Whenever we are giving a prompt, we say use IAP guidelines, use references from the PubMed, use Cochrane database, use CDC database. This is most important that it is not hallucinating. That has been told in detail, so I'm not going into the detail. And in a prompt, we also say there should not be any nuances and constraints. It must avoid the jargons. The word limit should be there. The language should be clear. And if we don't want to prescribe antibiotics, we have to clearly mention do not prescribe antibiotics. So that type of thing is there. And last and foremost important is your tone. When I say it should be a professional, then it will give in that way. When I say funny, it will give in that tone. When I say academic, the tone will be different. When I say emergency focused, then it will difference. Even the tone is having a low, medium, and high tones. If I'm using a low tone, in that cases, the chances of hallucinations will be less. So this is a basic prompt engineering in which, by this Prashant way, what I say is, I want AI. What do you want AI to do? Which expert the AI should become? And who is your audience? What clinical details matter? And how should the output look? Which guidelines AI should follow? And what should AI avoid? What tone should AI use? These are the few things which is there. So always, a good prompt will give you a better output. It's been said that whatever you are giving input, if you're giving input as a garbage, the output will be a garbage. If you're giving an input as a good, valuable things, the output will be a good things. If I just write fever in children, then the problem is it is too broad. No audience is defined, no context is there, no practical advice has been asked. So AI may generate unsafe content also. So in this case, the AI may give guideline of newborn fever. It may confuse newborn fever with teenage fever. Even the adult treatment doses may be given. It may skip the red flags. It may use complicated medical jargons or ignore the Indian context. So the better prompt will be act as a senior pediatrician, explain fever in 3-year-old child to Indian parents in simple language, include common causes, home care, red flags, when to visit hospital, and paracetamol dosing precautions. use bullet points and reassuring tone based on a IAP recommendation. So this covers almost all Prashant prompts which I have already written. So remember, AI is a tool and you are the doctor. So you have to use it wisely. Now coming directly to the hands-on demo in which, as Deepak has said to me, that we will be keeping it more practical. So the information which we will be giving will be helpful to you in day-to-day practices. So just give me a minute and I'll just show you my things. Fine. So I want one volunteer who actually volunteers for me, and we can have a OPD summary from our this things. Can anybody volunteer? Please write in chat box yes. I'm waiting for, yeah. So Ashna Kumar, can you please switch on your video? See, I'm going to share. Yeah. Can you see my screen? Because now I'll not be able to see the chat box.
Yes, sir.
Yeah. So the first thing is, see, this is a simple prompt engineering in which we are going to have our OPD case presentations. This is called as a pediatric OPD scribe. So say, for example, a patient has come to you in a OPD. What are the things you will ask?
First of all, the particulars of the patient,
Yes.
then
Then
the presenting complaints,
what are
their
the presenting
duration,
complaint of your patient?
fever.
Fever for how many days?
Sorry, sir, I didn't catch up those things.
Fever for how many days?
Sir, was
Fever.
there some prompt given? I didn't read that.
No prompt. We are just discussing that in
Fever,
OPD, the
okay,
patient has come to you. The patient is
okay.
coming with fever of 2 days. See, just a minute.
Okay,
Just a minute. Okay, just a minute. See, whatever you are speaking, I'm just showing you
yes,
the way in which the chat GPT is actually using your audio. Can you see my chat GPT screen? Pediatric OPD scribe.
yes.
Okay.
OPD
So
Scribe
this,
is the name that you've given yourself. It
yeah,
is a
I've given
chat
myself.
GPT platform.
That is the see, this you will learn tomorrow how to create this custom GPT, a pediatric
Fine.
OPD scribe. How will you learn? But at present, just focus that the patient is there. Say, for example, you are the patient and I'm the doctor. Okay. So it will
Okay,
become easy. So I'll just
okay.
ask you a few questions. You will answer me. And I'm just clicking on the dictate button. The audio the
Okay,
GPT is recording. And from
fine.
this, can we have some output of OPD notes which pediatricians will have? Okay.
Okay, okay. Right.
So, Ashna, you are a 3-year-old female with a weight of 12 kg. You came to my OPD. What are your complaints?
I've been having fever for past 4 days and cough with running nose for the last 2 days. Along
Is
with
there
that, decreased oral intake.
okay. Is there any same history in past?
Once I had such episode almost a year ago, for which there was an hospitalization for 2 days. I was given some nebulizations. After that, I didn't have a repeat episode.
Do you have any family history of same illness?
My grandfather had a undocumented history of asthma, as they say, but nothing other significant.
Do you have any skin allergies or allergic rhinitis?
Not sure about skin allergies, but yes, I do develop cold quite often, and mostly it happens when there is a change of weather or when there is farming season.
Have you taken all the vaccines recommended by Indian Academy of
Yes,
Pediatrics? Yeah.
yes, they're
So
all up
see,
to
this
date.
is just a rough history. Actually, this is to be asked to a mother, but I'm just asking to a
Right.
child. Now, see,
Mm-hmm.
this dictation is going on. Let's see whatever we talked came to our dashboard as the word file. Okay.
Yes,
When I
yes.
just enter this into my OPD case prompt, okay. Now
Okay,
this will search my knowledge. This how to build based on the history provided. This is a 3-year-old Ashna weighing 12 kg. Chief complaint you already said, fever, cough, decrease oral intake, right? History of
But they have
present illness.
it's written cough and rhinorrhea for 20 days.
Yeah, so that you have to correct. See, this
Okay.
can be some mistakes because this is, say, for example, when we have written over here also, cough and
Mm-hmm.
running nose for the last 20
Yes.
days. The audio dictation was wrong, which we can correct.
Okay.
But at present,
Right.
just to save the times, we have just given it.
Mm.
So it is giving you
Mm.
the note in which your chief complaints are there, the history of present illness is there, your past
Mm.
history is there, your family history is there. Allergy and atopy, which I asked directly, we usually don't ask directly because you are a doctor, you have answered it. But usually,
Mm-hmm.
we just
Mm.
say that the IAP, I mean, there was no family history of any allergic disorders or no repeated rhinitis in a family, that type of thing we say. And then the
Yes.
immunization history, we directly say that according to IAP, I've taken it. But then we ask whether you've taken influenza,
Mm.
whether you've taken pneumococcal, all these things we ask. And good thing is, we just talk for a 2 minutes and it has
Mm.
summarized the notes and written everything for us. If I want to type this or write this, it will take at least 5 to 10 minutes.
Right.
But with
Yes.
this type of dictation, it is subjectively summarizing. The most important thing is the provisional diagnosis is given is acute febrile illness with upper respiratory tract infection or allergic rhinitis with viral exacerbation. Or the differentials which are being given is protracted viral cough, post-viral cough, early reactive airway disease, episodic wheeze associated with viral infection, acute bacterial rhinosinusitis if symptoms are more than 10 to 14 days with fever or purulent discharge, right?
Right.
Now, the beauty is it is giving you the plan also. That
Mm.
complete physical examination, vital assessment you should do, respiratory system examination, hydration status, consider CBC CRP if clinically indicated, symptomatic treatment and adequate oral hydration, and further management based on examination finding. Okay. So as a doctor,
Yes.
what I will do is on examination, the vitals were normal. She was having a respiratory rate of 36 per minute, saturation of 95%. Mild pallor was there. Rest all general examination was normal. On systemic examination, bilateral wheezing was present and there were no subcostal retraction or intercostal retractions. So this is my systemic and general examination which I have done and I just spoke to this. Then it is again actually adding these things to our history in a way vital signs, general physical
Mm.
examination, respiratory system findings. See, I have not said no nasal flaring, but it has added because
Yes.
I said there is no tachypnea, no retraction. So
Mm.
if there is a nasal flaring, that means there will be a tachypnea or a that can be a distress finding.
Fractions.
Even I have not said about the CVS, but written S1, S2 heard normally, no
Mm.
murmur. Soft, non-tender, non-distended, no organomegaly. CNS conscious, alert, and age-appropriate response, no focal neurological deficit. And now the provisional diagnosis is this. Okay.
Mm.
And now the plan is because the presence of bilateral wheeze, previous hospitalization requiring nebulization, family history of asthma, and recurrent seasonal nasal symptoms, the first plan given is nebulized bronchodilator therapy as clinically indicated. Again, the guardrails are being given into this because of that. It is not directly saying the name of the drugs and the doses. If you want, you can upload some respiratory books or PDFs regarding the bronchiolitis. If I upload say for example, the standard treatment guideline of management of a child with asthma or a GINA guidelines of asthma, if I've added
Mm.
this in this uh, custom GPT, which again, I'm not going to teach you today, they will be tomorrow's session, but if you added that, then according to that, it will grade your asthma, whether this child is having asthma or not, or if it is asthma, then what is the grade and which step 1, 2, 3, 4, 5, what you should start, that will be given. Even antipyretics for fever, hydration, monitor respiratory rate, all these things are given. And now this is final impression wise a preschool viral wheeze. Okay, the
Mm.
first document recurrent wheezing can be there. Now, the beauty of this is again, if my
Mm.
diagnosis is preschool viral wheeze,
Hmm.
Now, this is my diagnosis. Okay. Now, I just
Hmm.
want to explain this to my parents. Okay.
Hmm.
Yes.
Yes.
So I'll just go to the my, yeah. So this is the second thing which I have done. So our diagnosis at present is, we can say, just let us say asthma. Okay. And you are from which place, Dr. Ashna?
Amritsar,
Amritsar. So asthma, Punjabi.
Punjab. Hmm.
Okay.
Yes.
Just enter it. See, you can read it. I cannot read it.
Hmm.
What is written? Please tell to our audience.
Sorry, sir. I basically belong to Jammu, so I
Okay.
am
Okay.
now
So
currently in
Jammu. So
Amritsar, but
I
I
can
don't know
I
how
can
to read.
read.
yeah, yeah. Please,
Prashant,
please.
I
Yeah,
can read.
Mohit. Yeah, Mohit, please.
स्क्रीन क्लियर नहीं दिख रही है. Your maybe the net issues. Your
अच्छा
screen
कोई
is
बात नहीं,
quite.
हम एक काम करते हैं,
आ
अस्थमा
गया.
हिंदी कर देते
ਇਹ ਕਿਹੜੇ ਵਿਸ਼ੇਸ਼ज्ञ ਵੱਲੋਂ ਸਮਝਾਇਆ ਗਿਆ. अच्छा हिंदी आ गया.
हैं। मैं वही बोल रहा हूँ, थोड़ा डिफिकल्ट पड़ रहा है
Yes.
तो हम सबके लिए
Hmm.
हिंदी कर देते हैं। अस्थमा
Yes, sir.
या किस विशेषज्ञ ने द्वारा समझाया गया है? बाल रोग श्वसन विशेषज्ञ, पीडियाट्रिक पल्मोनोलॉजिस्ट। अस्थमा
Hmm.
क्या है, यह क्यों होता है, सामान्य लक्षण, इसका निदान कैसे किया जाता है, महत्वपूर्ण जांचें, उपचार, माता पिता घर पर क्या कर सकते हैं, संभावित जटिलताएं, रेड फ्लैग साइंस, सामान्य माता पिता के प्रश्न, क्या अस्थमा संक्रामक बीमारी है, क्या अस्थमा पूरी तरह से ठीक हो सकता है, क्या अस्थमा वाला बच्चा खेल सकता है, क्या इनहेलर की आदत पड़ जाती है, क्या मौसम अस्थमा को प्रभावित करता है, क्या अस्थमा और एलर्जी का संबंध है, क्या पालतू जानवर समस्या बढ़ा सकते हैं, क्या केवल खांसी भी अस्थमा का लक्षण हो सकती है, क्या अस्थमा वाला बच्चा स्कूल जा सकता है, क्या अस्थमा जानलेवा हो सकता है, क्या धूल अस्थमा बढ़ा सकती है, क्या व्यायाम से अस्थमा बढ़ सकता है। Even it has given Mithak Banam Tathya, means the facts and
Myths and
myths.
facts.
And the last message, this information is for education and should not replace consultation with your treating healthcare professional. So, in a OPD, when I was having a child, 3 year old, in which if I was suspected asthma, this chat GPT, a large language model, has actually helped me to write a OPD note. That is fine. Also, the common questions and explanation which I want to give to parents is also been said. Now, I can have it in any language. This we have seen in Punjabi, Hindi, English, whatever language I say, it can give it in a minute. And I can just give a printout to a patient. Isn't it beautiful? But
Yes.
most important thing is before giving it directly, you have to read it because sometimes it can hallucinate, can make mistakes. If I'm giving this, that uh, say for example, sometimes a chest X-ray to rule out other condition is given, but sometimes it just says you have to do X-ray chest to rule out asthma, which can be a wrong thing. Okay, because this has been created in such a way and the things are being added so it is not hallucinating, but it happens that it can hallucinate. So I can just take a printout of all these things and give it to parents and this will be helpful to them. Now what additional things the generative AI can do is, I'm again showing you live only. So say for example, these are the red flags. I'm just copy pasting this red flag signs, and this red flag signs I'm just entering into yeah, into one other custom demand in which I just added that red flags of asthma. Now I'll just do one thing. I'll just search a photograph of Narendra Modi. Okay. And I'm just copying his photograph and pasting over here. I think it is just taking some time for the photo, but then let's wait. So same way, instead of the Narendra Modi's photo, you can have your photograph and give a command. This command is, I'll show in other chat GPT, but at present I've created. See, I usually don't want to type repeatedly the command, so I just made the shortcuts. So I'm showing you that by just entering this, a red flags and photograph, I want to make a Instagram carousel or a post which I can post it. Actually, how to do it, I'll again show you in different message, but these are my shortcuts. These shortcuts will save my time. Anytime I want to do any images, then it will do it. And believe me, it can give you results in less than a minute or so. So it is adding some final touches to our prompt and giving the images. So you'll learn three things. One, documenting the OPD complaints into a typical format, which will look very good. See, we have talked for around 5 minutes, Dr. Ashna, and in that case, time only, our OPD note is ready. Only I have
Yes.
to check it and edit it. Say, for example, I'll just check it and edit it and give it. Then you will see that your patient will say, I have been given a OPD note in detail. So if I want to judge Dr. Ashna, I'll judge from the OPD consultation only. That okay,
Yes.
she has this many questions and written this many things, means she must have given around 30 minutes to a patient for
Hmm.
writing, asking, and checking, but we have given only 5 minutes. And now, say for
Yes.
example, this image which we have put, okay, now without doing anything, it is generating the ask your pediatrician what are the red flags of asthma, seek urgent medical attention, the beautiful images which are being generated, and with your name, and this is my Instagram handle which is already there. Now why I've made a custom instructions, because I don't want every time chat GPT to remember how I want to make my images. That's why I've given it. Otherwise, you have to give every time whatever work you want to do. For that you have to give a command, and that command, if you remember, that is fine. Otherwise, I always create the commands from the prompt engineering by Dr. Prashant way. Now I want some other volunteer also. uh, Please unmute and say your name, because I'll not be able to see in the chat. Anyone else? We want to generate something. If you people interact, that will be better, because I don't have any PPT presentation. I'll be showing you all the practical demos only. Anyone?
Yeah, I will do.
Yeah, sir, your name, please.
Mohit.
Mohit Sani.
Yes.
Yeah. Okay. Right. See, we are writing step one. This is how we build a prompt for anything. So it is asking you, what is your purpose today? What you want? You want to write something, you want to explain something, you want to summarize something, you want to create something. All example answers are also been given. So tell me one thing, what should AI produce?
Create a discharge summary.
Create a
What I
discharge summary. Okay.
No,
Create a
generate an SOP for no, sorry. Generate an
what?
SOP for NLC success.
Generate. Okay, इसमें है ही. Generate an SIP for
Yes.
NICU sepsis management. Okay, good.
Yeah.
So you are selecting what the AI has suggested you. Okay. So we are just copy pasting. Generate an SOP for NICU sepsis management. Okay. This is your purpose. Now role. What is your role? AI should act as a senior neonatologist, NICU consultant, pediatric infectious disease specialist, hospital quality and accreditation expert, medical college professor. What is the role of AI?
Senior neonatologist.
Okay, so act as a senior neonatologist. Confirm? Okay.
Yeah.
That is your second step. Now, third step. Who is your audience? This SOP is meant for whom? NICU staff nurse, pediatric residents, DNB, MD pediatric trainees, consultant neonatologist, NABH accredited hospital staff, newly joined NICU healthcare workers, or a multidisciplinary NICU team. What is your audience?
DNB, MD, pediatric.
DNB and MD pediatric training. Okay. This is our third thing which we have selected. Okay. Specific details. This is where SOPs become truly useful and practical. See, please explain as many applicable, like early onset sepsis, late onset sepsis for both, level of NICU 2, 3, 4, preterm term or neonate. So to just save the time, can we select all? I want everything in SOP.
Yeah.
Is it okay? Just to
Yeah.
save, because I'm not giving only one thing, I'm saying do everything. Referral, transfer criteria, infection prevention bundle, everything. Now, specific details and follow-ups. Okay. So example, okay, he's saying, okay, please provide your preferred choice because we have selected everything. So one, early onset and late onset. Two, your level NICU is NICU level 3.
Yeah.
3, it is all neonates.
All units.
First, or any specific investigation? No, everything is fine. Any specific antibiotic policy guidelines to follow? Any guideline you have in mind? Antibiotic policy guideline. Dr. Mohit?
CPG guidelines. NNF CPG guidelines.
NNF CPG guideline. Okay. So this is the prompt we have given. Next step, it will ask us how to format. You want this with headings and subheadings, NABH compliant SOB format, flowchart, bullet point protocol. What do you want?
Flowchart.
Flowchart plus SOP, right?
Yeah.
See, at present, this is our junior guide who is actually guiding us that these are the things which should do. Accuracy and references, again, use NNF CPG guidelines only or with latest WHO recommendation or with recent evidence-based research.
Yeah,
You
third
want
one.
only NNF CPG?
Yeah, no, third one, which is use
Third one.
NNF CPG. Yeah.
And recent evidence-based literature. And in that additional thing, include a reference list at the end, yes, so
Yes.
that it can give you which references it has taken, okay, and antibiotic stewardship recommendation, again, yes,
Yes.
we want this also, okay. This was not in our mind plan, but it is suggesting and we are saying, yes, we want this also. So nuances and constraints, it helps that include resident responsibilities at each steps, admission to discharge workflow, sepsis screening, antibiotic stewardship, common mistakes and how to avoid everything. I mean, it says everything, avoiding excessive theory and microbiology details, limiting. I mean, so I think I can take all these things together. Just a minute. Include and avoid is perfect. Word limit, how many words you want. Executive will particularly give in less than 5,000 words. So I'll say word limit is 2,000 words. Okay. And number of pages, fine. NABH compliant format, yes, because if I want to go for that in future, that will help me. So I'm taking that also. Okay. And the last, the tone. Since your SOP is for DNB, MD pediatric level 3, NABH compliant, NNF CPG based flowchart plus SOP, mostly many users choose professional, evidence based, practical, and bedside oriented with consultant level teaching point. Is this fine?
Yeah.
Yeah. So we are just choosing that. And it is giving me a final prompt now. So the final optimized prompt ready to copy paste. Purpose, generate comprehensive standard operating procedure for NICU sepsis. Role, act as a senior neonatologist. Audience, DNB students, specific details, all these things which we want. How to format NABH compliant, accuracy, nuances, avoiding, and everything is there. This is, I'm just copy pasting. And now in a separate chat, I'm just posting this. And you see the generative AI wonder, a standard operating procedure in ICU sepsis management. early onset sepsis, late onset sepsis, because you said this text-based management algorithm. Neonate with risk factors and or clinical signs, initial clinical assessment, stabilize ABC, obtain blood culture, septic screen plus baseline investigation, EOS less than 72, LOS more than 72, start empirical antibiotic as per NICU policy, reassess after 24 to 48 hours, culture positive, culture negative, monitor response and everything, the purpose scopes, definitions, the risk factors, the clinical recognition, the common conditions which is there, the common escalation required immediately in cases of all these things. Initial evaluation checklist is also been given. Investigations as indicated are been given. A sepsis screening protocol. Positive screen if more than two parameters are abnormal. Now, this is from the NNF-CPG that the total lymphocyte less than 5,000, ANC low for age, BP ratio more than 0.2, micro ESR more than 15, CRP more than 10. Interpretation negative, observe if asymptomatic, positive, treat as probable sepsis. Blood culture collection protocol also, how to take it according to weight, documentation, lumbar puncture indication, contraindication, empiric antibiotic policy, antibiotic escalation strategy. Escalate if this, de-escalate if this. Antibiotic stewardship pearls like culture before antibiotics, narrow spectrum antibiotics wherever feasible, daily antibiotic review, avoid prolonged empirical therapy, document indication and stop if somebody's voice is coming up. Consult approval for reserve antibiotics, culture positive sepsis, management this, negative this, antibiotic duration suspected 36 to 48 hours, culture positive 10 to 14, meningitis 14 to 21, gram negative meningitis maybe to more than or equal to 21 days. This is the supportive management of fluid, shock, respiratory, hemodynamic, glucose, nutrition, the monitoring protocols. What are the things you will monitor? Like heart rate, respiratory rate, SpO2 continuously, BP 4 to 6 hourly, temperature 4 hourly, urine output 6 hourly, glucose as indicated and weight daily, escalation criteria, infection prevention bundle, CLA BSI prevention bundle, I mean the catheter related, ventilator associated infection prevention, documentation requirements, admission to discharge, resident workflow, admission, daycare and discharge, what is there in referral and transfer and discharge readiness, quality indicators and audit parameters. Blood culture before antibiotics more than 95% is your target. Hand hygiene more than 90% is your target. CLAPSI rate benchmark is monitored. I mean, see, can you see the beautiful this given and the references? The NNF CPG guidelines, the Sankar MG et al. State of Newborn Health in India, Journal of Perinatology, WHO managing possible serious bacterial infection in young infants, Geneva guidelines, all these things. Isn't this the beauty of AI? Can you find anything wrong in this, Dr. Mohit?
No.
Unmuted because there was a background noises was there.
Yeah. So he said no. So this is a beauty by which you can actually generate a simple prompt. See, if you are going to give a prompt, then will you give this big prompt for only a sepsis management SOP according to NNF CPG? Let's see. See, basically, because my GPT is now trained, whatever inputs I'm giving repeatedly, it is in this Prashant format. So even if I'll just type that, can you give me sepsis management bundle according to NNF CPG guideline? Then beauty of this is because already the prompts are said so many times and so many things I have done regarding this type of management. Actually, it can give me something like this. Step 1, recognize sepsis early, the signs, risk factors. Step 2, septic screen and culture before antibiotics. Step 3, start empirical antibiotics. Even giving the names, ampicillin, gentamicin, common organisms are this. Late onset this. Hemodynamic stimulation bundle, airway breathing, circulation, fluid bolus, inotropes. But in this inotropes, again, Dr. Mohit will agree that dopamine has been given first, which may not be there And this is the hallucination which can happen without when you give only a generic information, right?
Yeah.
So always, when we are giving a prompt, see, somebody is looking at this will think, oh, it is actually giving everything, but we find one mistake in this immediately without going for the much detail. Okay. So if your prompt is better, then your output will be better without the hallucination, and that is the best thing. So I hope you people are there with me till now, that how to give prompt, how to actually give this prompt. So I'll just copy paste this prompt for you people and we'll give in chat box so that you can just try, and can somebody share so that we can have the proper hands-on experience which we are having. Can some other person volunteer for this? Do we have some name, Dr. Deepak, or should I go ahead?
I will ask
Because if you
someone.
practice with me,
Yeah.
yeah, if you
We'll
practice
call
with me,
Dr. Manisha. Are you there? Dr. Manisha?
Yes, yes, sir. I am there, sir.
Please, you can share your screen.
Sure, sir.
I'll just
Yeah, you
stop
can.
it. Okay, Manisha, do you have a paid version or a free version?
Free version, sir.
Free version. Okay. Can you just copy paste this thing which I have just shown?
Yes, sir.
You can just copy and show us your screen.
Already it entered into the chat GPT.
ChatGPT. Yes, yes. But now you have to share the screen.
Yes,
The
sir. I'll share
bottom,
it.
in the bottom, there is a share button. You ask.
Yes, sir.
I hope
Entire
I'm not
screen, no?
very fast, Deepak.
No. Time is there.
Okay, no. No time. My speed is not very high. I mean, I'm
No.
worried.
It is okay. They are following. They are following.
Yeah.
Yeah. Your screen is
Science.
visible.
Yes, sir.
Just copy paste from the chat.
Yes, sir. So whether my screen is visible?
Yeah, it's visible.
Yes.
I just wanted to ask Prashant sir whether it is like possible in free version or do we need to take a paid version of this?
For making the custom, see, there are two things.
Yes,
The
sir.
prompt engineering Dr. Prashant way, if you want, in a way in which I have shown to save the times, then you need to have a paid version. But there is a catch also. You can have a free also. How? Okay, I can't directly assess the content because it's a private GPT conversation. Okay, fine. So now what you can do is I'll just share one more thing with you, and that will help you. So you just type over here in your command,
Yes, sir. Yes, sir.
and this, by the time I'm just taking. What do you want to do at present? Let's start with from your side only. What do you want to do first?
We will continue with the same NICU guidelines and like sepsis guidelines for sepsis control.
I will suggest, because we are having a hands-on one, I have already shown. You can choose other
Okay.
topics so that you can actually have some more
Uh,
idea.
okay. Uh, then seizure management in
Caesar.
like,
Okay. So can we
yeah.
can we just say febrile Caesar? Okay.
Yes, sir.
Because
Yes,
again
sir.
that will help. So write down in your chat box what is your purpose to create a febrile Caesar guideline. That is your purpose. So please create a febrile Caesar guideline. That is your first step, right?
Okay, sir.
Now, please create a febrile
Yes, sir.
Caesar guideline. Okay. Now,
Array,
comma.
yaar.
Oh,
Sorry. It has
fine.
like entered.
Definitely give. See, if you see, It is giving you the definition and everything, but we just want to avoid few things. That's why we just want to give full prompt. At present, you have said that please create a febrile seizure guideline. If you can just scroll down, it is giving
Yes, sir.
you everything. But then we just want to have some more thing. That what is the role? It is a senior pediatrician.
Yes, sir. Means
Okay,
I'll just write it down. Please create a febrile seizure guidelines. I am a senior pediatrician.
the senior pediatrician. That is also
Yes.
fine.
Okay.
Now you want to explain this to parents or to the parents. I mean parents or the residents.
I want to explain to the parents, sir.
Parents. So just write down parents.
Okay.
Parents of 0 to 6 years. That is better.
Yes, sir.
That is your thing. Now specific details. So you can just, I mean, see, instead of now typing, you can just click on this
Mike.
audio button. Yeah.
Oh.
Okay. So you can say uh, focus on first time febrile seizures and explain what the parent should do during a seizure. Include warning signs. What are the signs which requires hospitalization? You should cover causes, treatment and prevention, and also discuss simple versus complex febrile seizures. Right?
Sir, sorry. Actually, I started mic very late. Will you please repeat
No
it?
issue.
One,
Okay.
1 second, sir. Yes, please
Focus
start.
for children aged 6 months to 5 years.
Yes, sir.
You should focus on first time febrile seizure. What is simple versus complex febrile seizure? You should include warning signs requiring hospital visit, cover causes, treatment, and prevention for the Indian parents.
Yes, sir.
So that is done. And after that, we will tell them, I want the answer in a form of question and answer in a bullet points only. Okay.
Yes, sir.
And once you enter this, then it
So
will
only
say,
1 second,
okay.
sir. It has come only my prompt means
Oh, oh, oh,
your
oh.
prompt has not entered in this.
So you can just speak whatever I've said now.
Okay, sir. Okay, sir.
Yeah. See, I'm purposefully showing you so that there is no mistake. Yeah.
Focus on the febrile seizures, first onset febrile seizures, including with atypical and typical febrile seizures, and create guidelines to the parents in the question answer format. What else we have
According
said,
to the
sir?
IAP guideline. No, no, continue. Please continue, Mike.
Yes.
Yeah. Okay.
Okay, sir.
Again, again, dictate. You continue.
Uh,
According to
yeah.
IAP guideline,
According to the IAP guidelines.
that is our reference, okay, which we are giving. IAP guidelines. We want to give it according to IAP and avoid any hallucinations.
Yes, and avoid hallucinations.
The tone should be professional.
The tone should be professional.
Leave it. Okay, fine. Okay, so you have covered all Prashant things. 8 things you have covered. Okay,
Yes, sir.
now to the prompt and see the difference. See, the good thing is by mistake you already given one prompt which has given you the output. Just
Yes,
enter
sir.
it. Just enter it. Yeah. So initially and go upwards. Go upwards now. By the
Yes, sir.
time it is
First
done,
one.
go up. Yeah, first one. So see, initially you have said that give me the guidelines. Yeah, slowly come down. Come down. You've just given a prompt that please create a febrile seizure guideline. So it has given definition, then
Yes, sir.
classification. Next. Definition, classification, simple,
Simple
febrile,
complex
complex.
pregnancy.
Yeah.
Hmm.
Then initial assessment, then history,
History.
yeah, fever, seizure, previous history, examination, investigation, neuroimaging is also there, acute management, and if more than 5 minutes, then what is there? Now see, this guideline is for doctors, but what you wanted, Dr. Manisha, was to explain to parents.
Yes, sir.
So whatever your aim was there, it is not fulfilled. Though this is perfect, whatever things are given. Now see for your guidelines, what is generated by your prompt.
Yes.
You can just
What
say
is
it.
febrile seizures? Yeah.
Ah, you can speak, ma'am.
Yeah. What is febrile seizures? It has answered the yeah. Then what does febrile seizure look like? Then what is simple febrile seizures? Typical and atypical, simple and complex. And are these dangerous? What should parents do during seizure? What should they do? What should they do not do? Uh, when should emergency medical care should be? Then what should parents do after the first febrile seizures? Does every child need blood test? Does every child need CT, MRI, EEG, LP? Fever medicines prevent febrile seizures. Will my child have another febrile seizure? All these questions come from parents. Does a
Yeah. So
febrile
it is
seizure mean
normal.
my child has
See, this is
epilepsy?
what you wanted actually, right? You don't want to
Yes,
manage a child. Okay. So
yes, sir.
now this is a way, even if you are not having a paid version with a free version, but for that you should remember all the points which you want to give. Don't give only a single line prompts. Always give a descriptive as many things as you think parents will ask you. Just add into the prompt. That will be better. Okay. This
You created very smart way of prompt.
Yeah, yeah. Okay. Now one more thing, because I've already shown you how to design it. Select any
Yes,
one
sir.
question which you like.
Like whatever I want.
Yeah, whatever you want, just select that question from this.
Acha, this one. No. Acha, whatever question I want.
आपको जो
Okay.
भी लेना है ले लीजिए.
Yes. Does febrile seizure mean?
हाँ, कॉपी कर लो पूरा. पूरा आंसर के साथ
Okay, okay, sir.
पूरा कॉपी. Okay.
Yes,
Now
sir.
paste it in your chat, and now audio जो मैं बोलूंगा वही again. Now
Okay, sir.
my purpose is to design an Instagram post
To design an Instagram post
in a square format.
in a square format,
It should be visually appealing to children.
it should be visually appealing to the children.
Design like a VFX designer.
Designed like a VFX designer.
Do not add words into this.
Do not add words into this.
And at the end, put my name.
And at the end, put my name as Dr. Manisha Munkar. Yes.
Fine. That's fine. Okay. And create an infographic, please.
And create a infographics, please.
Okay. Done. So by this parental education things, whatever you have done, now you are going one step ahead. What I have created as my instructions, I don't want to repeat every time. That's why I've made a custom. But if
Yes.
you want, then you can just do it like this. Now, please enter it.
Okay, sir. It will take time.
It will take 1 or 2 minutes time. Okay. Create richer image set, get plus. Okay. So that is actually, see the, for you, what will happen is it will actually give you almost 4 5 image, and then will tell you, please try after some time. When I'm using a
Actually,
paid
even
version,
sir, since afternoon we are trying this images what you have posted in the WhatsApp. That's why maybe 2 to 3 images I have created. I don't know whether it will create or
no, no,
not.
it is creating. See, if it was not going to create, it would definitely tell you this time only. You reach to a limit. Try after this time. That will
Yes.
definitely come. This image will be there.
Anisha,
Yes, sir.
can I add? Can I add,
Yes, sir.
Prashant?
Yes,
Yes,
yes.
sir.
See, the technology behind this imaging is there is lot of competition is going to take place in your GPU.
Yes, sir.
I told you, GAN, that is a general adversarial network.
Yes, sir.
All these things are going to take place. That is why, because it will denoise your image and it will make the again generation of the new images. It will take time.
Okay,
So
sir.
that is
Okay,
why
sir.
images and video will take long time. Then the textual message will be very instant like.
Yes,
Okay.
sir.
So
So
you can
now,
think of, yeah, Prashant.
Deepak, please, Deepak, complete.
So these are the, see, you have to go to the basics now, how these machines are trained. See, that is
Yes,
what
sir.
I'm telling you. So language models will answer very fast. Whereas if you come to the reasoning and making the image models, no, it will take lot of time because lot of competition is going to take place inside.
Yes, sir.
It has to understand your prompt and it has to understand how the output will become as a desired output.
Yes, sir. Yes, sir.
So the way we how talk to the machine, that is why prompt engineering is a very, very important in artificial intelligence.
Yes, sir.
And always
Understood, sir.
whenever you do some prompting, no, you go to the basic data sets, what is taking place inside. That you should know, not as a detail, as a pinch of salt, you should know what are the things which are going there. So that you will be in the real time and you will be in the current and you know the what is the things which are going to take place. Yes, Prashant, please.
Yeah. So now you see, this is the exact example of a image following your commands and not adding any words. I actually commanded that don't add any other words, means
Extra
whatever
words.
words, extra words. But it understood that as a don't add any words. So now again we can edit this image and say please have the words like this and it will give you. So please now stop sharing. You can try it and it will give you. But then I've shown you two things, OPD, image generation, as well as this. Now, one or two more things and then I'll hand over to Deepak. See, coming back to our original case of asthma, I mean, see, which was there. Now, suppose this child, Dr. I just forgot the name, Dr. Ananya
Ashna.
or
Ashna.
Ashna, yeah. So Dr.
Yes.
Ashna, our patient was of asthma and that patient was admitted, right? Now admitted.
Yes.
Because in the past
Yes.
history. So say for example, this patient has been admitted to our hospital and
Hmm.
we do have the summary of the child. I'll just check it. Yeah. This is the OPD summary, okay? So I'm just
Yes.
copying the OPD summary and this child
Hmm.
was admitted. So now what I'll say is, see the beauty again. The 3-year child was admitted in our NICU, in our PICU. On admission, child was tachypnic, oxygen saturation of 90%. So the child was kept on ERVO with 30% FiO2 and 12-liter flow, and then the child was maintaining saturation. IV antibiotics and IV fluid along with the salbutamol nebulization was started. Gradually, as the child improved over a period of 2 days, the RO setting was decreased and child was kept on oxygen. And in a 1 day, the oxygen was also removed. Investigations done, which were showing hemoglobin of 10, count of 12,500, neutrophilic, few atypical lymphocytes were seen, CRP was 35, chest X-ray was suggestive of right lower zone pneumonia. So we thought of continuing the antibiotic, and as the child improved, we have discharged the child with oral amoxicillin and we have explained the parents about the danger signs. Please give me the discharge summary of this patient. Okay. So this is how our patient behaved, right? Okay. Now in this,
Yes.
if you are having some notes, see, I have just said what is the story. But if you are having some notes, then you can just put the pages in a PDF over here and it can analyze. Now I'm just entering my OPD patient history, which I've copy pasted from there, and the course in the hospital, right? Then
Hmm.
see the discharge summary, beautifully it is giving the patient name, weight, UHID number I have not given, so not provided, date of admission discharge, not provided. So it is saying you have to provide final diagnosis because now X-ray was right lower lobe pneumonia, which was there. And this was acute wheezing episodes with anemia, with atopic predisposition. These were the presenting complaints. These were the significant histories. These were the examination findings on admission, vitals, RS, CVS, CNS, everything. These were the investigation. If I uploaded by masking the names and every identifiers of this, then all investigations will come directly. But to save the time, I just dictated this and it just took over here. It took the hospital course also and treatment received. Okay. high flow nasal cannula, the RO which I said 30% flow 12, everything. Condition at discharge, discharge medication. I've not provided the dose, so I have to provide it, frequency and duration. The follow-up visit also said, the red flag signs also been said, and a parent counseling done in form of this. Discharge outcome prepared by consultant, date, everything. Okay. So isn't it saving a lots of time?
Yes,
So you
definitely.
have to make the summaries formats by yourself. Say, for example, I'm comfortable with this format, which this is my format, so I'm comfortable. If you are comfortable with any formats, you can have it. Second, you can actually, since my hospital is started, since last 20 years, we are having a habit of entering the data into Excel sheet and then doing a word merge into the Word document. But since last 6 months, now we just upload without the patient data the all things as an Excel sheet into this, and this prompt will actually give me the full discharge summary. If I want to write this discharge summary, it may take almost half an hour. But with this prompts, but most important, you have to always recheck. Sometimes it can add the things, sometimes it can remove the things. So till now, we have learned prompt engineering, OPD, discharge summary, generating image, and let me check if anything else which I kept ready for you. Yeah, okay. One more thing was okay. Counseling we already seen, right? That
Yes.
we have to create that. Where is that? There is a one. Okay. We just create our own counseling scripts, which I've shown. Now, those who are adolescent counselors, they may be doing this heads examination, which is totally different. It is not as same as the our mm, OPD. So I just made for my heads examination because I'm doing adolescent counseling also. So you can just see it is asking me the age, gender, reference number, and everything. And if I say a 15-year-old male child who has been called as Vikram, accompanied by parents, having a complaint of decreasing grades, academic grades since last 1 week without any previous consultation has come to me. So this is my case which is there and I've just entered the detail. Then it will guide me. It will write down all these things and they'll guide me to ask first thing which is home. Okay. Why it is still answering? Okay. Yeah. Okay. So when it is saying me to answer, take the history of home, then I'll say the child is living at home with parents and a younger siblings. The relation with parents is good. He is close to his mother. He feels safe at home. Uh, there is some conflict between the mother and father on small issues, and there is a financial difficulties in family. Also, the father has lost some money in share market. So this is the history which I have asked for the home. It is automatically adding and summarizing this and then asking me for the next history, which is regarding the education. Vikram is studying in ninth grade. His academic grades were 90%. Recently, since a week only, his grades are decreasing. He is not going to the school regularly. He used to enjoy school, but now does not enjoy the school. No bullying or cyberbullying in school. He doesn't have any learning difficulties, and his future goal is to be a dancer. So, this actually helps me further history taking. It is entering all the histories, impression it is adding, then it is asking for the activities. So, Vikram is going to a dance class, practicing dance every day 2 times, both Western as well as the Bharatnatyam. He participates in sports, plays cricket for 1 hour. His hobby is to travel. He is close to friends. At present, I'm giving a dummy names like Vijay and Naresh. His screen time is less than 1 hour. He doesn't spend online gaming time. not use social media platforms, and no issue with online safety. Then the next history, according to the heads, will be of a drug history. So whatever I'm saying or asking, it is actually summarizing, and then it is asking me about the drug use. So Vikram is not taking any medication, supplements, or protein powders, not taken drugs, vapes, alcohol, not dependent on mobiles, and not addicted to internet. Sorry, digital use was there, but I just said by my things. Okay, fine. The substance use, sexuality, both the things. Now, the sexuality wise, he's not having any issue regarding puberty or physical development, not in a romantic relationships, no attractions or crushes, no sexual activity, not use contraceptions, no activity, so no consent, and no history of unwanted touching, sexual abuse is there. Any history which comes in adolescence can be there, but I'm just giving a rough example how to take the head's history and how this will help it. And the last part, sorry, second last will be suicide and mental health. So his mood has been recently changed, remaining sad, worried about the future as there is a financial loss in the family, not able to sleep, sleeps late, wakes up late, and appetite is decreased, feeling worthless these days, lost interest into the things like dance and cricket which he used to love, is not doing it, not thought of harming or not harmed himself, and not done any suicidal attempts, and he just want to have some talk with a mother because he is close to a mother, and how to cope with this. So this is my next mental health history which I am going to ask. Once this has been asked, I have full report. Then last is spirituality. So he is believing in Hindu religion, believes in meditation, does Om chanting. It helps him for a stress relief, and it also gives him some purpose in a life. And the last is his strength. So this strength will be, his main strength is that he can talk to the mother, get support from the mother, can dance, can meditate. His goal is simple, that he want to participate into a competitions and win the dance competitions. And please give me some counseling guidelines for this. Okay, so out with this, we have just finished the heads assessment, and the case summary, if you can see, a 15-year-old child, full summary is been given in a way which you want. It is giving you the risk assessment like mental health, moderate risk issue, suicide low, substance use low, sexual health low, family environment is mild to moderate positive, problematic, academic functioning decreasing grades, and safety concerns are low. The red flags present are recent school refusal, sudden academic decline, persistent sadness, anhedonia, sleep disturbance, appetite reduction, feeling of worthlessness, family financial stress, and the differential diagnosis over here will be adjustment disorder with depressed mood, early major depressive episode, stress related anxiety disorder, mixed anxiety and depressive symptoms. Medical, if you check and find anemia, thyroid, or nutrition deficiency or sleep disorder, then you have to do that. And for counseling guidelines, a supportive counseling has been given, a cognitive and behavioral strategies are being said, restoring the daily routine, behavioral activation, the dance, cricket, meditation, talking to a mother and friends. And for mother, the advice has been given. And for parents, all these things and the suggested investigations, that you can go for the PHQ-9, GAD-7. Even it can say that if it is a depression more than the BDI-21 or anything, and the medical evaluation and referral things with a follow-up plan can be said by these things. But the most important thing is always verify. Disclaimer always is given with this type of things, that this assessment is intended for educational and clinical support purpose only. It does not replace a comprehensive evaluation by a qualified healthcare professional. A clinical decision should be based on direct history, examination, and a professional judgment. Any concern regarding abuse, self-harm, suicidal thoughts, severe mental illness, substance dependence, or serious medical condition requires urgent evaluation by an appropriate healthcare provider. So thank you so much. I think I have covered
Yeah,
whatever I
Prashant.
want to cover
Yeah.
in this short time.
Thank you, Prashant. You are nicely engaged. Unfortunately, our other live session suddenly went abruptly closed. Then
Oh,
again, we took one more platform, Zoom, and again it is restarted, and now it is going very smoothly.
we are
So
lucky that our session was gone. Yeah.
yeah. It was a good. Now I think I should thank Dr. Prashant Kariya. Now I will show you how the different aggregator LLMs will work. I will share my screen
Deepak,
as
just
a
1 minute
Python.
before you share.
Yeah,
Just 1 minute. Deepak, I have a one emergency call from the hospital. I'm thankful to you
please,
for
please.
announcing, and I can
Yeah.
just leave.
Any questions can be asked. You can answer. You can ask in the WhatsApp group. No problem.
Okay, the one question, how do we edit this image? In that image, only give reprompt that please use the same words which I have given and keep it. So that will be there. So thank you so much.
Thank you, Dr. Prashant. Thank you very much. So, guys, can you see my screen?
Yes, sir.
Yeah. So I will show you in Claude what are all the things are there. Features. See, Claude is, all of you know, it's from the Anthropic. This is the open screen you have. I have a premium version. See, these are all the things, chats, previous chats, projects. See, I have a project completely. I've done this small, it's everything I do from here only. So it will memorize whatever the prompts I have given regarding this academy, all the details, everything. It will be there. In fact, the web page, everything I've done through this projects only. Similarly, you can also do a lot of projects in this premium cloud version. You have artifacts. Here you can do a lot of research reports, okay, professional bios. You can elicit some brochures also, you can do it. This is artifacts. So this is a cloud design where you can do a lot of apps, your website design, just like in the productivity and apps. When it comes in that model, we are going to show you this part. See, next I'm going to show you this aggregator platform called Arena AI. You can type in your laptop arena.ai, all of you, arena.ai. It's a free. So what is the beautiful thing about arena.ai is the LLM aggregator. You can see two simultaneous side-by-side LLMs. See, these are all the LLMs you have. See, you can use Claude, Opus, all these things. It is number one, it is standing in the leadership board. In the text arena, if you see, it stands, it has, because it has scored more than 1,500 times. So this is how the ranking of LLMs will comes with your feedback. I'm going to the new chat. See, here you can choose two modes, either bat mode, side-by-side mode. See, you can see here, two models you can choose at a time. Either a text model, it's a China's GLM Z.AI. You can choose Grok. You can type it here. You can write ChatGPT. ChatGPT is also going to come, the latest one. Same time at the side, you can compare with another. Say, for example, if you click DeepSeek model is going to come. So here you put a chat. So tell me newer advances in dengue vaccines development. Okay. So just give a prompt by selecting two LLMs. So it is going to generate the output. So since I have taken a thinking model, it is thinking now. All of you are following? Somebody can unmute and tell.
Yes, sir.
So you can try this, arena.ai. You can download it, you can copy and paste it. So this is a one LLM aggregator. You can check single LLM also at one time. It's a battlefield. So anonymous AM will be, it is selected by Arena only, not by us. We don't have any control. Whereas here we have our control. And there is one more called agent mode. This is a newer things they have added. It will select the agents, various agents, multiple agents. It will get orchestrated. It will going to give the output. Got it?
Yes, sir.
So you can go to the direct also, directly one chat at a time. Okay, here you have web search is also there option. You can generate the images also. You can do the coding and build apps also. All these features are there here. In leadership, if you come to this leadership board, see here you can choose whatever the wherever you want expert also you can select, and you can tell what types of things you need. You can click on the view more. Okay, you can select even health also categories. So you can choose whatever you want in this board. So you can develop, you can see the web development. So whatever the things you can select here. See here chat mode in the top. All these things you can play around and you can see. So you try with different LLMs with the common things. Whichever you think which is very good, you take the premium version. And you may be wondering why these people are giving free of cost. Why? Because you are giving after the outputs of two models, you are giving the feedback which is good, which is not good. According to that, this ranking will comes. This is called reinforcement learning. See in the text arena, you have 360 models. And many tech people are using more than 6 million people are using all these things. These are the models which have been trained. So you can customize the category, whatever the model you want, and you can select according to that. This is how you are going to select the model. So any doubt about this arena? So next platform what I am going to show is POE. So this is POE.com. This is ChatGPT. Yeah. Can you see my screen? POE. Just
Yes,
Yes,
sir.
yes, sir.
POE.com in your browser. All of you
Yes, sir.
can follow.
Yes, sir.
See, this is also aggregator platform. Here many tools will be there. Many ChatGPT 5. You can select this if you want. Okay. So you can create a new chart and you can go. You can also do some customized GPT like thing. It's called bot. Okay. You can see here now. This is the PDF pilot which was done by us from our IAP CMIC chapter maybe 2 years back. Why I'm telling you is, see, this has been trained 2 years back, not now. If you ask any questions regarding nowadays single dose HPV vaccine, it is going to give hallucinate. See, that is what I wanted to show you. Just I will go to this PDF pilot. See, I have asked the prompt here to the PDF pilot. Okay, this was been trained. Okay, very long back, 2 years back. It is not yet updated. I asked her, I wanted to know about single. There is a printing error is there. Again, I have given again front. I wanted to know about single dose HPV vaccine recommendation in a children of 9 years old child. So it is asking, it is telling, it doesn't have any idea because it has been not updated. 2 years back, that was not there. Only 2-dose schedule was there and 3-dose schedule about 15 years. If you come to ChatGPT now, where I have updated, now I am not in the POE. See here, in the PediVac guide that I have shared with you, no, I have put the same prompt. See the, yes, according to the latest recommendation of IAP, both the girls and boys, this is the recommendation. What about the single HPV schedule? So WHO endorsed single HPV vaccine strategy in a group that is like a government policy one. But when it comes to individual level in your clinic, you have to advise as per the IAP guidelines. Because 2 doses or 3 doses according to age has got full course immunization has got complete zero positivity. Whereas if you take it in government program, single. So you got it now, how the models, if it is not updated, it is going to hallucinate. Is it clear for all of you?
Yes, sir.
So it's poe.com. What it is?
Yes.
It is not
It's the
opening in
aggregator
my
LM.
laptop.
It's the aggregator LM.
Okay. No,
It's
it's not
just like
opening
a
in my
chat
laptop.
Pardon?
It's not opening in my laptop.
I will send
It's
you
what?
another link. Don't worry.
Okay, sir. Okay, sir.
Arena got opened.
Yes, yes. Arena. In that we have to like search, or in Comet we have to search.
Madam, I will share once again my screen and I will show you. Okay.
Okay, sir.
Don't get confused. See, this is the Arena one. Okay. You are in the page.
Yes, sir.
Share your screen, madam. That is the better way. I'll stop sharing.
Okay, sir.
Better you share because this is demo session. No worries. Just share your screen. I will let you.
Yes, sir.
Here, entire
I
screen.
opened this Comet, and it's Arena.
Yeah. Go to the top left. Arena.
Yes,
You click
sir.
on the Arena. You click on
Yes,
the new
sir.
chat. Click on the new chat. Yeah. Go side by side. Close your assistant, right side. Right side browser mein assistant into button
Yes.
is there. You close that. It is obstructing.
How to close
top
this?
assistant ke baaju upar.
Acha, okay. Yes, sir.
You close this. It is blocking. Yeah. Now you
Ah.
take the battle mode. You change it to side by side mode. Yeah. Now you give the prompt. You select the model whatever you want. There is a Gemini Pro is there. You just scroll
Yes,
down the
sir.
button. You click. You can select whichever the model. You type search. You select Claude CLOID. Type CLOID.
Claude Sonnet 4.5.
Whichever model you want.
Yes, sir.
See, Claude Sonnet is a very fast. Claude Opus is a
Okay.
very good reasoning. Okay. In ChatGPT, huh?
Yes, sir.
Okay. So now you ask any prompt. You type whichever the things you want. So you have to play around with this agent. This is a free. So make a morning ritual that once your meditation, everything over, whatever the things which are there, queries previous in night you have, you can put it and you can see the outputs in different LLMs. Whichever you find very good, you copy and paste it and use a premium tool like Claude or anything, Claude Opus or anything. You got it?
Yes, sir. Yes, sir.
Here you need not have to spend a lot. This is another way of using Claude. Okay, you can
Yes,
use
sir.
as many times as you want. There is a pro version of LM Marino is also there. Now you come to the
Okay.
left side, madam. Do more with AI agent. Try now. In the left tab, left side, complete.
Yes, sir.
Down. Try now.
Yes,
You
sir.
click. Not hide. Try. Yeah. So this is the agent mode. So
Yes, sir.
agent mode में क्या होता है? You just give a prompt. The agent will decide. Something like you have a stock brokers, no? Stock agents.
Yes, sir. Yes, sir. Yes, sir.
You are just investing. They will do how to distribute your stock. So वो
Okay,
काम
sir.
ये agent करेगा. You got it?
Acha. Yes, sir. Yes, sir.
For new persons, we tell this Arena LM and POI, you try this. Once you got which LM is better for your types of prompt and all, then you can take a premium version. That is the main aim
Yes.
of showing this demonstration. All of you got? Dr. Mala, Dr. Aruna,
I was not
Yes,
able
sir.
to open POE, sir. That's why I asked.
just type now.
Where,
You
like, in
put
which,
up
like,
Chrome browser, put on the plus button, just POE.AI, go to Google search, down.
yes,
Yeah.
this one.
Now
Okay.
you click here. See,
Yes, sir.
perplexity
Got it.
sometimes it will do some harm. But search engine will be Google only better. See,
Yes, sir.
this
Got it.
much amount of this thing you have. See here.
Yes, sir.
So continue with. So idea of showing this basic fundamentals is you should know about aggregators in the beginning. Got it?
Yes, sir. Got it, sir.
So
Got it.
okay, you can stop
Yes.
sharing. Anybody has any doubts? So stop sharing the screen.
No, sir.
I think how was the class today? Devendra,
Very
Dr. Devendra,
interesting,
all of you can
sir.
unmute and talk openly. There is no nothing. So I think this is the third or fourth class through this platform. Graph is not giving much help for me. So see, for batch 2, today suddenly the session went off. Then we made one more Zoom attend because we are all collaborating faculties. We don't have anything hide and seek. Our aim is to give the knowledge to you people at low cost. That is our aim. Suddenly Samir opened his Zoom meeting premium version. He created a new meeting and started, and it is still going on. I am in my another device. I am still on that. So I am interacting with both of you people. So I think from next, tomorrow onwards, we will go with the Zoom only with a direct link. No need to come to Graphy and all because hardly it costs 15,000 rupees for me for Zoom meeting for 1 year. And monthly I add on 1,000, 1,500. It is not a big thing. Up to 100 people in one plan. Only problem is Zoom with I can't do 2 live sessions at a time in one account. So I should create one more account and do it. I think Zoom is the best, I think. So what I will do next time, I will record from the Zoom and then I will give the Zoom link directly with the recording and I will upload to the Graphy. It will be there in Graphy. Whenever you want, you can go to your Graphy account and you can see and visualize it. Okay. I think if any doubt is there, we can discuss. So tomorrow your session will be very, very important. Please don't miss. You are going to do your own custom GPT. Okay. For that, I'm telling you, it will cost around 400 rupees for you. Go to ChatGPT if you are a free version. Take the Go one, not the plus one. You take the Go subscription, 400 rupees. Till 1 year it will be there. You have that and start creating ChatGPT. And in Google Gemini, if you have a GeoGym, you have a Google Pro version with you. And you can I will show you how the jumps will appear. I will share my screen again.
Deepak, one sec. ChatGPT Go version is $3.99 per month. That one you are telling?
Yeah. You go with that. If you are liking, then you take. Then only you can do customize the ChatGPT. Okay.
I have a Geo version, so that Google Gemini will be free, no?
Yeah, that is I'm showing you now. How and all. Yeah, I'm going to my Gemini account. All of you can able to see my screen now.
Yeah.
So this is my Gemini account. see, you have to come to full bottom. See a jump in settings, you have to go. You can see jumps now. So these are my gems I have made. Pediatric helper, vaccination one. So tomorrow Dr. Harsh and Dr. Gaurav are engaging you regarding all this custom GPT and all. And also they are going to share you regarding how the clinical diagnosis by using screening and diagnosis, you can use some AI tools. This is because all of you know AI models are now using for only screening purpose, not for the diagnosing purpose. And also you have 20 minutes demo session from two people, how to screen autism by using AI diagnosis by visual this thing. And also you have one more demo from a fundus team, how to diagnose, screen the retinopathy of prematurity by doing angio scanning of with probe and also with the camera taking this thing. Those who are having your neonatology practice and all, it's going to help us. So live demo from the persons will be there, 20 minutes, 27, and you have this important custom GPT also. So be ready for tomorrow. I'm going to send you the Zoom link directly to you. I think because batch 1 has already Zoom integrated. So you plus directly log in through the Zoom. Don't worry about password. Don't worry about graphy. Okay. I think with this, we'll make it a day. Thank you very much. And recordings will be always available. Okay. Anything, please put it in the WhatsApp group. Okay. So thank you very much. Good night. Bye. I'm going to end the session.
Okay.